Hello, I'm Dr. Oscar Menendez. I'm one of the chairpersons for this year's Mission of Mercy event.
How you doing? I'm Dr. Chris Bolness. I'm the other chairperson for this year's Florida Mission of Mercy. We would like to welcome and thank you for volunteering.
The Mission of Mercy event is the Florida Dental Association Foundation's premier charitable event. We're hoping to treat about 2,000 people at this year's event and provide around $1.5 million worth of dental care. We are doing this in hopes of giving these people self-respect, dignity, and eliminating pain.
This year's Mission of Mercy will be held in Lee Civic Center, March 9th through 10th, 2018. It's a great event, it's fun, and we thank you for coming.
We hope to see you there.
Greetings, my name is Steve Zuknik. I am the Co-Clinical Director for the 2018 edition of the Florida Dental Association's Mission of Mercy in Fort Myers. Thank you for your dedication and volunteering to help these patients in need, and you are very much appreciated for making such a big difference in their lives. I'm in charge of the preclinical areas for this event. Those areas consist of patient registration, patient education, medical triage, radiology, dental triage, and patient routing. Please be on the lookout for a series of emails in which you will receive information and a link to protocols specific to the department in which you volunteered. Familiarize yourself with these as well as the site plan of the venue and the clinic floor so that you can be made aware of your duties as well as where you are to perform them. You will also receive important information you should know before you arrive on the day of the event. Proceed to Whaley Hall and check in with volunteer registration, where you will receive a shirt and a name tag. You will then proceed to the Lee Civic Center and go to your specific department and check in with your department lead. They will provide a verbal orientation with the rest of your shift. Your lead is there to assist you and help you have the best experience possible. But please help them by being as flexible as you can be. We are all out of our element, but what you are providing for our patients is beyond fantastic. Thank you again for being a part of the Florida Dental Association's Mission of Mercy, and I look forward to personally seeing you in Fort Myers.
Hello, my name is Steve Bryan. First, I'd like to thank all of you for volunteering. Many of you have participated at the events in Tampa and Jacksonville. If this is your first Mission of Mercy, you will be absolutely amazed and want to return for future events. I just wanted to take a few minutes to hit some highlights of the clinical protocols. Rest assured that in several weeks prior to the event, you will receive an email with more detailed information as well as written protocols that will be pertinent to your activities, in particularly the oral surgery section. Please try to familiarize yourself with these protocols, but before each clinical session begins, we'll hold a brief orientation in the oral surgery section to answer any additional questions that you may have. We expect to see about 2,000 patients over 2 days, and we can expect that at least half of those will require oral surgery procedures. To that end, we have 32 designated chairs for the oral surgery section, and each volunteer surgeon will likely have 2 chairs available. Surgery instruments and supplies will be provided. Keep in mind that these are donated instruments and often aren't going to be what you're used to working with in your office. So if you do desire to bring some of your own instruments, there will be a separate sterilization area for personal instruments. This year, the sterilization area is immediately adjacent to the oral surgery clinic. As you can imagine, there's a lot going on during the Mission of Mercy event, so I would kind of like to add the caveat that if you're bringing your own instruments, you're doing so at somewhat at your own risk. That being said, in Tampa and Jacksonville, I, like many other people, did bring some of my own instruments and really didn't have any real issue. There are a limited number of surgical drill consoles that are being provided. These are non-irrigating drills. If you prefer to bring your own electric drill system, please do so. There are adequate electrical plugs available. Each dental chair is equipped with a 4-hole handpiece attachment, so if you have a surgical drill that's air-driven and can use that attachment, please feel free to bring that type of drill. If you're accustomed to working with the headlight, I would strongly recommend bringing it. We hope to have 2 assistants for each surgeon. Mission of Mercy events are a great team building experience, so hopefully many of you will be bringing your own office staff as well. There are doctor's chairs provided, however there are no assistant chairs, so feel free to bring any chairs that would be comfortable and feasible for you to bring. Now, just a little bit about the treatment philosophy of the Mission of Mercy. You know, we're trying to address the most urgent needs of the patients presenting for treatment, to put out the fire, so to speak. It's important that we do a reasonable amount of treatment on as many patients as we can. Each patient will come to the oral surgery clinic with a panoramic x-ray and a recommended treatment plan. This treatment plan can be modified by the treating surgeon. If you have any questions about the treatment plan, please ask your oral surgery clinical leads. This is not like treating patients in your office. Please be flexible and come with an open mind and an open heart. Because of the environment in which you will be working, be careful not to get yourself in a bind with more treatment or more complex treatment than can be provided in a Mission of Mercy setting. There will be no numbing stations this year as at previous events, so all the patients will be anesthetized in their respective clinical areas. After treatment is provided, post-operative instructions will be reviewed by the doctor or assistant. Packages of gauze pads will be available to be dispensed. Our standard instructions will include recommendations for over-the-counter analgesics. Your oral surgery leads will have printed prescription pads for antibiotics and prescription analgesics to be dispensed on a limited basis, period. Please familiarize yourself with the color code card system that is included in the treatment protocol. Wear comfortable clothes suitable for patient care. You will be provided with a Florida Mission of Mercy t-shirt when you check in on your treatment day. Please make entries into the clinical treatment form in blue pen only, so please try and bring some blue ink pens with you. We're looking forward to a great Mission of Mercy and serving a population of patients with tremendous dental needs. Thank you again for your support. We'll try to keep things moving as smoothly as possible and make this an enjoyable experience for all.